Hello and welcome. My name is Dr. Jack, and for this video we'll be talking about the details of Alzheimer's disease. It is a terrible affliction to have and one that affects many people around the world, and currently there is no cure. And what made me want to do this video was that there has been recent research that came out that looks at your body's own endocannabinoid system, your body's own cannabis system, and how exactly cannabinoids can play a role in regards to a possible treatment down the road. And as always, an early thumbs up or like for the video is really appreciated. And without further ado, let's just jump straight into the details. Begin with, let's talk about some statistics of Alzheimer's disease. It is the sixth leading cause of death within the United States. It actually kills more Americans than breast cancer and prostate cancer combined. And 1 in 3 seniors die with Alzheimer's or some other form of dementia. And more than 6 million Americans are currently living with this terrible affliction. And by the year 2050, it is estimated that if there is no cure for Alzheimer's disease or significant treatment, it will cost the United States about $1.1 trillion due to our ever-increasing aging population. So one of the websites I really suggest checking out is the Alzheimer's Association. It really is an all-encompassing website, and they even have a hotline that you can call to ask questions. And so if you want to fill in sort of the gaps of knowledge after this, please be sure to check it out. As always, the links or any pertinent links will all be down below in the description. So what is Alzheimer's? Alzheimer's is a type of dementia that affects memory, thinking, and behavior. It actually eventually becomes so severe that it interferes with everyday functioning or interferes with your ability to perform activities of daily living. It is the most common cause of dementia, and it accounts for 60 to 80% of dementia. And the biggest risk factors are increase in age, as most of the people with Alzheimer's diagnosis are age 65 and older. It is a progressive disease, meaning that it gets worse over time. And it basically starts with some memory issues, but ends with the inability to hold even a conversation or interact with your environment. Once you are diagnosed with Alzheimer's disease, the average lifespan is about 4 to 8 years, but it can go as high as 20 years, but the average is 4 to 8 years. To dive into the different stages of Alzheimer's, essentially in the beginning or in the early stages, you see difficulty learning new data or information because Alzheimer's affects part of the brain that affects learning. Then eventually you see things such as disorientation, as well as mood or behavioral changes, and confusion on things like time, place, or events starts to pop up, and they also can become very suspicious of family or friends. Eventually, it leads to more serious memory loss and the behavioral changes mentioned. And during the final stages, they have difficulty with speech, swallowing, and even walking. So if you experience this or if you see it in a loved one, because oftentimes what happens is that the person that actually is suffering from Alzheimer's actually has a difficult time identifying it themselves. So typically a family member or someone that very close to the patient is the one that first brings it up. So if you see this, then be sure and talk to your doctor or your clinician about it, because the earlier the diagnosis, the earlier they can get treatment to sort of slow the progression. But as mentioned before, there currently is no cure for this. So how should we think about Alzheimer's and how exactly it affects our cognitive decline? So you should think of brain cells, the 100 billion brain cells or nerve cells, also called neurons within your brain, as little factories. Within these factories, they receive supplies and they generate energy, as well as, make all the equipment that they need. And they get rid of anything that they don't need or the waste. And in Alzheimer's, basically what you end up seeing is interference with the factory operations. Currently, we do not know exactly where it starts, but you can think of it as issues in one part of the factory causing problems elsewhere. And eventually what ends up happening is that the damage spreads and the cells cannot function, they eventually die, and this leads to irreversible changes within the brain. And two of the abnormal structures that are prime suspects in the damage and killing of the nerve cells are plaques and tangles. So what are plaques? Plaques are deposits of protein fragments called beta amyloid, and this builds up between the nerve cells. And tangles are basically twisted fibers of a protein called tau proteins, and that builds up within the nerve cells. And so you have something that builds up on the outside and something that builds up on the inside. And it's worth noting that most people have plaques and tangles within their brain upon death. However, Alzheimer's patients are noted to have considerably more of this. And we are not totally sure what plaques and tangles do within Alzheimer's. However, the theory is that they block communication and interfere with the effectiveness for nerve cells to talk to each other and ultimately cause that cell death. So how does the endocannabinoid system or the cannabinoids play a role in all of this? And by the way, if you need to get sort of a primer and get some background information on the endocannabinoid system and cannabinoids in general, I'll put a link up below. Check out my previous videos. I have several videos kind of detailing and explaining what the endocannabinoid system is and how exactly it works within our body. There have been numerous studies that has shown that cannabinoids, specifically CBD, has been shown to decrease or remove inflammation, not only in our various joints and things, but also at the brain level. And it reduces oxygen buildup, which can lead to cell damage and therefore decrease brain cell decline or destruction and act as sort of a neuroprotectant. And if you ever need to know more, Project CBD is a fantastic website where they have a lot of great studies and articles discussing the details. And again, the link will be placed down below. You should know that scientists of the US government filed patents in 2001 for cannabinoids as antioxidants and neuroprotectants, stating that they have potential to treat Alzheimer's and other dementia type diseases. And they found that delta 8 THC as well as delta 9 THC, CBD, CBC, CBN were all potent and effective neuroprotectants. And if you don't know what all those are basically just a few of the cannabinoids that are within the cannabis plant out of over 150 different cannabinoids within the cannabis plant. So let's talk about the study that has recently been discussed at several different websites. And it was the Medical College of Georgia at Augusta University. What they did was basically take a 2-week high dose of CBD and were given to mice, and they found that it helped to restore function of two very important proteins labeled TREM2 and IL-33. And these two proteins are crucial to decreasing the beta amyloid plaques and improve cognition, and they are mainly found within the brain. They are key to the brain's immune cells to basically consume dead cells and other debris like the beta amyloid plaque, and people with Alzheimer's disease have been shown to have decreased levels of both of these proteins. And what they also found was that another protein called IL-6 was decreased. And what this particular protein does basically is associated with inflammation that is seen within Alzheimer's. And there have been numerous studies in the past that have shown the anti-inflammatory effects of cannabinoids, specifically CBD in general. And just some more details on the interleukin 33 or IL-33. You can basically think of it as the neighborhood watch. You know how you have a neighborhood watch that is there to protect and make sure that everything's okay. And what they do is basically it sounds the alarm and creates a cascade of reactions that ultimately dials down the inflammation. Essentially what it does is it tries to provide balance or homeostasis again to the immune system, much like what your endocannabinoid system is designed to do. And when we take a look at TREM2, this is a protein that is found on the cell surface, namely a particular cell called microglial cells, which are special immune cells that are found in the brain that wipes out foreign particles like viruses and severely damaged neurons. So you can basically think of the two proteins as housekeepers of your brain, and they are key to the microglial cells consuming things like the beta amyloid and things of that nature. And what they found was that when they gave CBD to these mice, they ended up with a 10-fold increase in the TREM2 protein and a 7-time increase in the IL-33 protein. And they also observed the behavior of the mice, and they found that the mice were able to differentiate between different items like familiar versus new items. And they also observed how the mice move. And within the Alzheimer's mice, they were found to be stiff and had impaired gait, basically the movement disorder that is seen in Alzheimer's. And they noticed that the mice with Alzheimer's ran in a tight circle and that this behavior stopped when the CBD was given. Now, there's still quite a bit of research, obviously, that needs to be done, as this study has been done in mice, and this is where most of the data comes from. But they're currently focusing on getting the optimal doses, as well as giving CBD as early as possible and seeing what the differences are, because within this study they gave it during the late stages. And they're also exploring different inhalers for delivering directly into the brain, as opposed to what they did here, where they introduced CBD to the gastrointestinal tract every other day for 2 weeks. And for those of you that follow the channel and have watched my other CBD videos, you know that the route that you take CBD makes a big difference. And if you want to watch that video, I'll link that video above as well as below in the description also. And you have research as well as companies looking at how to deliver CBD in an inhaled form to the lungs for things like ARDS, which is acute respiratory distress syndrome. And what happens is that this is seen when people get very, very ill, such as we're seeing in the current pandemic, or if you get sepsis or develop, a severe blood infection or trauma to the lungs. And this leads to severe lung damage. And cannabinoids, specifically CBD, being a potent anti-inflammatory, can play a significant role here. So to wrap up this video, I hope you found it valuable and you learned a lot. And if you did, please be sure to hit the like button, as that pushes the video out further within the YouTube algorithm, and that's always appreciated. I also hope that you see why I am excited about this latest data that came out and where we're going in regards to finding a possible treatment or even a cure for Alzheimer's disease down the road. My hope is that in the future, we will look back one day and just see Alzheimer's as something, just yet another disease that we ended up curing, because I have so many patients I've treated in my clinic that have shown up with Alzheimer's, and I have followed them over the years, and it's a real devastating disease to watch people go through, especially for their loved ones as well as for the patient themselves. And so until next time, take care, stay safe, bye-bye, Pura Vida.